Again, my name is Kavya G. I'm here to facilitate this wonderful discussion about such an important topic, about menstruation and about preparing for menstruation. A lot of different taboos we're going to break, and also wonderful tips and tricks for hygiene as well. My name is again Kavya. I have a bachelor's in biochemistry. My master's is in education. And here in Chennai, I am actually a choreographer and a dancer, as well as I have my own company called Black Swan Dance. I've done a lot of different things in my life, but one thing that remains the same is that I have my period every month, and that's something that we definitely need to discuss, especially the different taboos are surrounding our period. So I have two wonderful guests with me. We have Dr. Swarna Lata, who's a professor at the Department of Obstetrics and Gynecology at SRM Medical College. We also have Tina Abhishek. She's a prenatal and lactation consultant at Apollo Hospital, as well as Kappa USA. She can maybe tell us a little bit more about what that means later. So again, today's discussion is about menstruation, early menstruators. It's for the parents who have young girls, and it'll help us deal with any uncertainties and any insecurities following menstruation. We hope that this session will equip you with knowledge to deal with the doubts and questions related to menstruation. And we have two wonderful people, two wonderful experts with us today to lead us in this discussion. And a huge shout out to Period Pals for putting this all together, and having us come together to discuss such an important topic. We'll get right into the questions. Swarnalata, Dr. Swarnalata, the first one is for you. Menstruation is still a taboo because it's not talked about openly. Many women and many girls are uninformed about their menstrual cycle. Could you explain exactly what menstruation is?
Okay, thank you. So actually, as you rightly mentioned, that menstruation is a very important topic. Every girl should know about that menstruation before she starts actually the first period, right? So here now, first we'll see what menstruation is. So it's actually, first I want to tell each and everyone here, it is completely normal process. It's a natural part of the woman's reproductive cycle, where there will be shedding of the uterine layer every month, which contains blood and some tissue. Okay, that is actually what the menstruation is. So how it happens means, here we think for menstruation to occur only genital or reproductive organ should be normal. It's not like so. So here actually the brain also should function normally to get the periods. The brain and at the same time the reproductive organs should function normally. So actually it is a transition from the childhood to puberty. So around the time of puberty, there will be a marked growth spurt, you can see the growth spurt, and at the same time profound hormonal changes. So these profound hormonal changes means the brain starts secreting some hormones. And these hormones will stimulate the woman's reproductive organs so that the egg will mature and release during every cycle. And because of that, again some hormones will be produced from the reproductive organs, and these hormones will help responsible in development of the uterine layer. Why this uterine layer first of all should develop? Means it prepares the layer to receive the embryo. So embryo means it is a very early stage of the fetus. Suppose in case the pregnancy happens, the uterus should be in an environment that it should able to receive that embryo. So that's why all these hormone changes happens every month. Suppose in case fertilization happens. Suppose if the fertilization doesn't happen, then this uterine layer will break and sheds. And this is nothing but what we see as a blood and some tissue is escaping through our vagina. So that is for menstruation. Okay. So here it varies from each person to person. So you should not feel that so it is normal. Which is more than 30 days or 40 days. It varies from person to person. Similarly, for the same person also it varies from month to month. Okay, so these you should be aware of and see whether it is normal and when should consult a doctor.
Thank you so much,
Thank you.
Dr. Perfect. What a great explanation in terms of the science behind what exactly menstruation is. Very important to know that. Again, guests, as friends, as you listen, and if you have any questions, please feel free to use the chat option, during our discussion in case you need any follow-up questions, because we will have a Q&A at the end. So any questions that you have, as Dr. Swarnalata or as Tina speaks, please do use the chat to talk to us and ask us any further questions. Thank you so much, Dr. Swarnalata. Moving on to Tina now for the next question. Many people experience mood swings and other psychological symptoms before a period. For most, the symptoms are relatively mild. However, for some females, they say that they experience severe symptoms that interfere with their personal relationships and maybe their day to day life as well. It's
Yes.
important to know the link between hormones and menstruation, for keeping our moods happier and healthy. So, what would be your comment on mood swings and maybe some ways to, ensure that we're at our optimal happiness and, healthy level?
There are a lot of things to discuss about mood swings, but as a parent and teenage young adults, we should first learn about how a body is functioning. So when I attend my menarche first period, so I thought that so only one time in life we will get blood from our vagina. So that is called menarche. So that sort of knowledge and education I had when I attended menarche. So we should explain this menarche and first period to our kids initially, so that is when they will understand. So our body is going, or our body is preparing for reproduction. We are going to give birth, or we are going to create a wonderful family for our community. So for that reason, we are our reproductive system is functioning every day or every month to prepare our body to accept a fetus. So if they started understanding the concept behind the periods, then they'll not think that it's a dirty thing, or they'll not think that this as a curse. So recently I've seen in the social media saying that one sportswoman, instead of being a woman, now if I could be a man, I could I should have no I could have win this match. So it's horrible to see a post in social media saying that being a woman is a curse, because every month I have to undergo these sort of changes in my life. We have to create an awareness saying that this is a very normal process. If you are facing any sort of discomfort, we are here to help you. It's nothing wrong in taking anti-inflammatory drugs with the help of a gynecologist. Okay, so in India, just like that, we will go and get medicine from the pharmacist, because that is not advisable, and it will not create any sort of side effects. Okay, we whenever we have headaches or other muscle aches, we tend to have some tablets, right? So similarly, if you are experiencing painful periods or any discomfort during your period, definitely you can go and check with your gynecologist. She will definitely help you with some medications. Okay, and we can discuss about nutrition and lifestyle in later sessions, I think.
Incredible. Thank you so much, Tina. Wonderful. We're going to move on to a very, very important topic, which is Minaki. I hope I'm pronouncing that right. And this
Yeah.
is the first period that a girl ever gets. There's a lot of fear and there's a lot of excitement around this. So let's go ahead and discuss this. Dr. Swarnalata, the first question is for you. What is the typical age? So there's three parts to this, doctor. So the first one is, what is the typical age when a girl first gets her period? The second is, what are some symptoms they may face? And the third is, if there is a delay, what are some of the reasons that a period might be delayed? So again, age, symptoms, and any reasons for delay.
Yeah. So coming to the age, it is not exactly one fixed age. It can vary, but around average is maybe 12 or 13 minutes. But extremes, it can happen as early as 8 years and can be delayed up to even 15 years also. Okay, if other things are normal, like secondary sexual characters are normal, you can wait till 15 years. If there is abnormality, then you have to start early evaluation. So the range here, it could be from 8 to 15 years, average 12 or 13 years. So that is, and basically it mostly depends some genetically and environmental factors also. And genetically means usually the girls attain menarche when their mothers or sisters attained age. So it depends on the genetic influence also. And then coming to the symptoms, so how to predict when the girl is going to attain menarche? So definitely we can predict when the girl is going to attain. So there are some pivotal changes, both physical changes and emotional changes that you can see in all adolescent girls. So coming to the physical changes, so physical changes, the first one is breast development. So here the girl will be developing some changes in the breast, means breast development will be there, and the girl will be developing hair in underarms and private parts, and there will be fat accumulation in the buttocks and hips, and the body smells because there will be increased secretion from the sweat glands also, and some vaginal discharge also will be there. So these are the some points to say that the girl has entered into the pubertal stage. And approximately between 2 to 3 years after the starting breast development, the girl will attain the menarche. So this is how we can predict the when she is going to attain, and we can start counsel the girl what are the changes she is going to get, and how the first menstruation will be. Like this, you can predict. And coming to the third question, what are the causes for the delay in getting first period? So as I already mentioned, so not only the reproductive organ, even the brain should function normally. That's why if there is some defect at the brain level, then periods will get some any brain tumors or any infection, whatever. So defect at the brain level can lead to delay in the menstruation. And similarly, defect in the developmental and reproductive organs like uterus or they say, if there is any problem, the baby means there will be delay in the menarche. And similarly, sometimes everything is normal, but even then there will be delay in getting periods like extreme malnutrition. So if it is the girl is very thin and she's doing exercise like athletes, so these also there will be some hormonal disturbances and there can be delay in attaining menarche. And sometimes the girl can get early, even less 8 years or 10 years she gets menarche. So these things may be overweight. If there is overweight, the girl is overweight or obese or in a stressful environment, then the girl attains menarche at earlier age. So these are the some causes.
Excellent. Okay. And any physical activity also that affects it as well, Dr. Swarnalata?
Yes, yes, extreme exercises like literally for athletes, it disrupts the hormonal production and changes in the menstrual patterns.
Wonderful. Thank you so much. Tina, we're going to go ahead and switch over to you. And this is again more about the psychological, aspect. And most women have maybe an irrational and sometimes excessive fear of monthly periods. And sometimes they're experiencing so much stress that their periods won't come. That's maybe all women who have had their periods can relate to that. Maybe stress of my period hasn't come. How can we get rid of that phobia? And also, can you just touch upon what PMS is as well?
Okay, so basically, premenstrual syndrome. So that is, all of the sudden, our body is responding to surge of estrogen and progesterone, like during pregnancy and postpartum. All of a sudden, the surge, our body can't take the surge of progesterone. So our body will respond in a different way. Like some women will be very irritable. Some women will be very kind of feel lonely or depressed, or they will explore or expose themselves in a different way. So, and they'll read a lot in Google or from other social media. So before menstruation, we have to eat this or eat that. because I'm in phobia, or my mood is not well. I'm going to shop online, or I'm going for shopping. So we tend to do involuntarily. Okay. So first thing we should understand that premenstrual syndrome is common. So if you feel like very irritable or extremely moody, or kind of very lonely, you have to focus on yourself, have a regular pattern of sleeping. So that is very important. So most of the teenagers and young adolescents, they're not doing it. Okay, so what they will do is they finish their work, or their studies and their assignments. Directly they'll switch on their gadgets, and they'll watch something in Netflix or some other movies, or they'll do some sort of things in social media, and they'll sleep around 2 o'clock or 3 o'clock or 4 o'clock in the morning. Then they'll wake up around 11 o'clock or 12 o'clock. They'll skip their breakfast. Directly they'll have their lunch, and they're very particular about the intake of carbs. So they don't want to get any carbs in their diet. So they'll take few vegetables, few amount of vegetables, or very limited portion of rice. So indirectly they are exposed into malnourishment. They think that their body is healthy, but it is not. Okay, so automatically when they due on a month, automatically they will experience all these symptoms of premenstrual syndrome. So what we have to do is make yourself plenty of rest. That is important. So rest is sleep cycle. So sleep cycle around 5 to 6 hours a day is really important. You should sleep in a dark place, and preferably within 10 o'clock to 7 o'clock. So that is the exact time for proper sleeping. So try to include more vegetables in your diet. Restrict your junk and hydrate your body. That is very important. And we will cover all the nutrition part later, because I have questions in nutrition as well. So yeah. So premenstrual syndrome, we have certain symptoms as I mentioned earlier. So every month, the most of the girls will have the fear of getting period, and some girls will have the fear of getting not getting the period. So if you are a person in second category, you have to focus on your lifestyle changes, exercise, diet, and sleep cycle. If you work on these four pillars, definitely you need not to worry about the second category. So if you are in the first category, you have to educate yourself. This is normal. If you face any difficulty or discomfort during periods, definitely consider visiting your family doctor or a gynecologist.
Wonderful. Thank you so much, Tina. We're going to stay with you for one more question before we switch to Dr. Swarnalata. And this is actually quite an interesting, topic, because I'm someone who was born and brought up in the US. So I've seen different ways, families react to menarche, right? Or the first time we get a period. In our Indian culture, a lot in many different parts of India, it's a celebration, right?
Yes.
And a lot of my friends from the US, it was not an event, it was not a function, it was just you got your period, move on, kind of thing. And so this for you, and this is very, very relevant for Indians, celebrating the menarche. Do you think that's going to affect a kid, and how will it affect their mindset and maybe peer pressure around the whole idea of celebrating?
Actually, I think most of the South Indians will celebrate menarche, puberty functions, rather than North Indian and other part of India. We used to celebrate for everything. So maybe for a first birthday or for ear piercing function, we will celebrate everything. Okay. So basic idea of celebrating puberty function is gathering. That is a wonderful thing. But when we think about the little kid, definitely it's an awkward thing. Why you guys are celebrating for this? Because I'm bleeding. I have cramps on my tummy. I'm not comfortable. You are saying that you should drink this gingerly oil, and I have to take a raw egg, but I'm not comfortable taking all these stuffs, and you guys are very happy about my first period. Why you guys are doing all these stuffs, celebrating my first period? I'm not comfortable with the celebration. Definitely, the kid will not think about all the celebration. So basically, Indian traditional culture is, so we celebrate for everything, literally for everything. Whenever we are happy, definitely we will do all sort of drama, and we will have a lunch or dinner together, and we have some activities for that. So when in the perspective of a kid, definitely it's kind of annoying. So over the period of time, if the we should decide if the girl and the family is comfortable, then we can celebrate these puberty function. If the kid and the family is not comfortable, we need not to force the family and the kid to do all sort of puberty celebration, puberty function, I think. So I think it's a peer pressure also. We may think that my mama's daughter attended puberty, so I have to celebrate that function in my family. So they are already pushed into the pressure that once my daughter attending puberty, I also now I have to celebrate the function. It's a kind of traditional from one generation to another generation. If you really think that you and your baby, your daughter is your daughter wanted to celebrate this, definitely you can go for it. Otherwise, you can celebrate Sweet 16 or some other function. Yeah.
Wonderful. Fantastic. I think that's a very interesting, topic to discuss, and I'm sure we can discuss further. But we will move on again. If you guys have questions, I see some questions coming in for the Q&A. So you keep typing your questions, you guys. Thank you so much, Tina. We're gonna move on to Dr. Swarnalata and kind of move on to a topic. Sometimes there's the fear of menstruating every month, and again how to prepare our children to face that with calmness and with bravery and everything. And so the first question, Dr. Swarnalata, is for you. So a lot of the times early menstruators are teens who undergo menstruation, and one of the common problems they face is irregular periods, or even maybe sometimes the opposite, which is frequent periods. Can you just explain the reason, Dr. Swarnalata, in terms of what could be the reasons for these irregular or frequent periods? And maybe someone has touched upon, or someone's asked how many days of cycle is considered normal. So if you can also touch upon that as well in this question.
So here, irregular periods means, as you said, it is a common gynae complaint. So whenever we sit in the OP, most of the girls they are entering the OPD means that we can imagine that the girl is having the menstrual problem. So here, one thing to note down is the initial few years after the first period, that is after menarche, maybe 2 to 3 years. So usually the cycles are irregular only. So we need not to worry in the initial periods. If it is after 2 or 3 years still it is irregular, then you have to start evaluating. So because why this irregularity in the initial periods means, it is because of immaturity in that all the we say it is a hypothalamus, this brain and the reproductive axis. So here the immaturity still persists. That's why this irregularity will be there, and you can just reassure the girl. But at the same time, you have to look for any other problem is there. So how to look means what are the common causes, whether that problem is there in that girl. So common problem nowadays is obesity and PCOS. So most of the girls might have heard about the PCOS and the obesity. So obesity is one important cause for irregular periods. So how to prevent with maintaining appropriate body weight. So we just counsel the girl to maintain or to reduce body weight. Then automatically periods will become regular. And then another important factor is stress. Again, stress can lead to changes or disturbances in the hormonal levels, and then it can lead to irregular cycles. So these are the two important causes, and girls should concentrate on these two things and maintain a healthy lifestyle. And as I already mentioned, even exercise also she has to look at the level. And when it comes to the pathological means some problem in the body like thyroid. Sometimes thyroid problem also can lead to irregular cycles. So we have to, before concluding it is a normal, we have to do some basic tests like thyroid test. So if the thyroid is abnormal, once you correct the thyroid abnormality, then automatically the periods becomes regular. So these are the common causes, and other causes like a brain, there is any problem in the brain or the reproductive organs, it is a major thing, and we have to take appropriate treatment. But before going to that, we have to see simple things that leading to the abnormal cycles, like overweight or any changes in the weight, not only overweight, even extreme malnutrition also, or stress factors, or PCOS, and then thyroid problems. So these we have to look at the, and then initial 3 years, definitely there will be irregularity. Need not to worry for the initial 3 years. So these are the causes for the irregular cells. Sometimes frequent cycles are frequent cycles. Again, frequent cycles also can be there in the initial years. Not only the delayed cycles, even frequent cycles also is common. Sometimes get the frequent cycles during initial 3 years. So that is also normal. But before coming to say that it is could be the normal physiological, we have to look for other causes like again thyroid problem. So thyroid not only causes delayed cycles, it can cause frequent cycles also. So again look for thyroid. And another important one is bleeding problem. If the girl is having any defect in the bleeding clotting system, then the patient can have frequent cycles and heavy bleeding. So these are the two common abnormal causes. And as I said, initial periods, the girl can have the frequent cycles. So these two causes. And another thing you asked about the normal menstrual duration and amount. Yes, it is very important. So the girl should know length, amount, and duration. So related to the menstruation, she should know what is cycle length, what is the amount, and what is the duration. So cycle length means that from the first day of one period to the first day of the next period. She should not calculate from the last day of the period. So it should be from the first day of the period to the first day of the next period is the cycle length. So usually it is around 21 to 35 or 45 days. If it is less than 21 days, again it is frequent cycles, that is abnormal. If it is more than 35 45 days, then it is again abnormal infrequent cycle. So the average is 28 days and the range is between 21 to 35 or 45 days. And coming to the amount of bleeding. So amount of bleeding, here we cannot exactly calculate how much blood she is losing, but approximately that is 30 to 50 ml. So it corresponds to 3 tablespoons. Suppose if it is less than more than 80 ml, then we should consider it as an excessive flow. How to know whether it is excessive or it is more than 80 ml? So there are two clinical indicators. So she can assess the number of pads, how many pads she is changing daily. So if it is more than 8 pads, or if the girl has to change every 2 hours, then definitely it is a abnormal thing. And another thing is passage of clots. So here, when compared to the I will tell you, passage of clots. If the clot size is more than 2 centimeters, again it tells you that the girl is having excessive bleeding period. Among these two indicators, the passage of clots is more reliable than the number of pads she is changing. Because number of pads she is changing, some girls, whenever they go to restroom, they have the habit of changing the pad. And some girls, they may not change even if it is fully soaked. So to certain extent, we can assess, but it is not exactly relevant indicator when compared to the passage of clots. And duration, it is 3 to 5 days. So if it is more normal duration is 3 to 5 days. If it is more than 7 days, again it is excessive bleeding.
Perfect. Thank you, doctor. I think a couple of people have also asked if it's normal to have regular periods but with less flow. That's is that normal, or is that okay? There's a question that's come up that's related to this.
Okay, so less flow and delayed periods. So causes are almost same only. Whether it is delayed more than 45 days or less amount of flow. The causes will be almost same like any overweight, thyroid. These are the causes, and we have to look for those conditions.
Perfect. Thank you so much, Doctor. That was very, very, I think, a lot of good information you've given us about, and I think it's great to know the numbers as well, so we can make sure that when we actually have a benchmark that we can use. So thank you so much. Moving on to you, Tina. We talked about some of the irregularities, or maybe even frequent periods. Now we're going to move on to maybe the psychological part of that, in terms of how do we keep ourselves positive, and how do we overcome such fears, and if there's any remedies for these irregular periods. I know doctor has mentioned some things about exercise, nutrition, so if you want to expand on that, or maybe give other things as well, it would be great to hear that.
I think 90% of the problem will resolve within if we follow a proper regular regimen of exercise and nutrition. Most of the girls are not following the proper diet. As I mentioned earlier, they are very particular about low carb intake, and they'll include very little amount of vegetables. So already they are malnourished. So they are our body is in a need of lot of iron intake. Okay, so we have to include more iron-rich food in our diet. But we are very focused on protein and fat. So most of the girls will eat only protein-rich food, because they're reading somewhere that protein will make them glow, and they'll protein is helping to build their muscle mass, and it's helping for hair growth and everything. So our main focus is only on protein. But whereas when we consider or when we check the intake of iron intake, most of the girls are not taking regular iron supplements or iron food in their everyday practice. So what we have to insist is they have to check whether they are taking iron-rich foods on everyday basis. In every meal, they have to check what I am taking for iron today. So if I ask a question like what did you have in the morning breakfast? So most of the people will say I had oats, I had omelette, or I had this or that. When I ask that where is your iron here? Then they'll be like, why I should take iron? So we are in a need to include iron-rich foods in our food plate. So that is very important for our body to regularize our hormones. And calcium, magnesium, vitamin B6. These are the very important vitamins and minerals are helping for regulating our hormones. Once you concentrate on these vitamins and minerals, automatically not to worry about your periods. Okay, so it will automatically come. And if you have any discomfort like dysmenorrhea is painful period, try consider taking ginger flakes every day. So that has improved the outcome I have seen for my clients. You can have soaked dry fruits like raisins. Basic idea here is we are giving iron in their food plate. So that is the main thing. So if you started taking more iron, vitamin B6 and B12, calcium and magnesium, so definitely you will see the changes. And mild to moderate workout. If you're fine with walking, go for a brisk walk for at least 10 to 15 minutes. That's completely fine. Expose your body to sunlight. That is really important, because we stay inside. See, I'm in the room, but I couldn't see any sunlight here. So it's all light, and it's like 7 o'clock in the evening. So this is how we live. Okay, so we have to expose our body to the sunlight at least for 15 to 20 minutes a day. Most of the pregnant women and postpartum after delivery and teenage girls are we are receiving we could see the vitamin deficiency early from the teenage till menopause. So we have to make sure we should expose our body to sunlight. That is very important for hormone regulation as well. And coming to the positive perspective, we should always think that this is normal, and don't think that it's a curse. Okay, so it's not a curse. You guys are creating the world. Without you, the world is nothing. Okay, so you guys are bringing beautiful baby for the community and for the society, not only for your family. We are really blessed to have this every month, because we are the one can create the create the baby. We are the real baby makers. So we should feel proud about it. So once you started accepting the process of menstruation, definitely you will not feel ashamed, or no, you'll not feel like you are cursed one. Okay, so again, I'm repeating the same thing. If you feel any discomfort or pain during your periods, you have to regulate your have a routine of having iron rich foods and vitamin mineral, um, vitamin D, sunlight exposure, and proper sleep, and mild to moderate exercises like brisk walking. If you know Surya Namaskar, you can also practice 5 to 6 sets of Surya Namaskar. Definitely, that will bring huge change in your menstrual cycle. Yeah.
Perfect. Thank you so much, Tina. Such wonderful tips. I hope you guys are noting them down. Thank you. We're going to go ahead and direct the next question to Dr. Swarnalata. Doctor, you already mentioned the flow, right? You mentioned what a low flow is, high flow, and even different ways to measure that. So we're going to actually switch to the color. And, if the color of the blood actually does signify something, and maybe you can touch upon quickly some of the different colors that you might see and what that means.
Actually, color is not doesn't significant, but the thing is only amount is important. So you see right color, I mean red color or the brown color. So brown color, when we have that brown color means if the amount of bleeding is less, then it takes some time to get through the vagina and come out. So during that time it turns brown color. Otherwise there is no significance for the color change. And during pregnancy, depending on the sometimes depending on the type of abortion, the color will change. But here, brown or red, and brown is if it is very less amount, it takes some time to come out. That's why the color will change. So here I want to touch upon the menstrual hygiene. So that is more important. Yeah. So how to manage during that period. That is very very important because it goes long way to maintain the girls or the woman's reproductive health. If there is any infection, then it can lead to so many complications later in the life. So proper hygiene should be maintained or should be done during the time of period. So how to do that? So first bath she has to take twice daily, and then before she has to change pads every 4 to 6 hours, and before changing the pad she has to wash, and after changing the pad also the girl has to wash her hands. Okay, so to prevent infection or transmission of infection. So before changing and after changing the pads, girl has to wash her hands, and then with warm water, lukewarm water, girl has to clean the private parts, and never use any deodorants or perfumes or talcum powder like that on the private parts. It is not, girl should not do that. And then after that, wearing the comfortable cotton, clean, neat, sun-dried cloth. So these are all some important points how to manage during the period. So she has to maintain hygienic at the same time. I mean, how to maintain hygiene. She has to change the pads and maintain strict aseptic precautions. It's more important.
Thank you so much. Hygiene is very important, and I'm so happy you touched upon that. That's actually the next topic we're about to jump into. So you paved the way for that. So thank you. Very good tips, guys, about how often to change your pad and all of that. So fantastic. Let's go ahead, Tina. I'm going to ask you again. I want you to touch upon hygiene as well. But before hygiene, can you quickly discuss discharge that comes? Because I know this is very common for girls and for women. So getting white discharge, is that normal? Is it a sign of deficiency? Can you just about discharge, Tina? And
So,
after that, you can go to poor, like what happens when you have poor menstrual hygiene, and what kind of risk and involved when we practice poor hygiene. So if you can touch upon that discharge and the repercussions of hygiene, that would be great.
Okay. Okay.
so right.
So
For Tina, yeah.
Okay, not a problem. Okay, so yeah, getting white discharge every month. Actually, we should check whether the kid or a woman is getting, when they are getting. Okay, so sometimes during after periods, in the mid of the cycle, we will secrete kind of white or a slippery discharge, egg white discharge. That is normal because when we ovulate, definitely we will see certain changes from our vagina. So that is normal. So if the girl is experiencing white discharge before or after, maybe before your period is also normal, mid cycle of your ovulation is also normal, before in between, if you get white discharge along with itching and other sort of foul smells, and I'm not comfortable with my vagina, so whenever I visit restroom after peeing, I can't tolerate the smell of my vagina. So that time, consider take a consultation from a gynecologist. Don't just Google it and get some wash from pharmacy or from the market and just like that, don't use it. Okay, so nowadays we could see wipes for intimate areas, washes are available in the market, and we are seeing a lot of stuffs. Okay, so recently I met one of my clients saying that she is washing her vagina with baking soda. So I was like, from where did you get this? No, she's like, no, she was saying that, ma'am, I have seen one YouTube video saying this. Whenever you have a white discharge or itchy feel in your vagina, just you can wipe or wash your vagina with baking soda or apple cider vinegar. So please don't use all those stuffs. Okay. So in lower part of South Indians used to apply neem powder, turmeric powder, and coconut oil and talcum powders. Now we should not apply anything over there. Okay, so actually it's a clean part. We need not to clean with soap and water or some other wash. So if it is advisable from your gynecologist, and they will give you some instructions how to use the wash. Okay, so you not to use it directly on your vagina. So that will kill your pH of vagina. So that then you are prone to develop infection, vaginal infections. So don't think your doctor as a military person. So in India, people will not visit doctors. They're very scared about doctors. See, we are here to help you. Okay, so we're not trying to we are here to help you. We are not here to harm you. So whenever I advise my clients to visit a gynecologist, they'll say, no, ma'am. They'll give bunch of tablets to ask me to take. Now I'm not comfortable to taking tablets. So for 1 or 2 days, they'll take tablets for vaginal infection. After that, they'll go with these vaginal wash and talcum powder and betarin wash. They themselves will decide they have bacterial infection, yeast infection, and they will diagnose and come with the remedies as well. Okay, so please come with the signs and symptoms. Let your doctor diagnose and let her treat. Okay, so yeah, and coming to the poor menstrual hygiene. So most of the time, girls are not using the public restrooms and school restrooms and college restrooms. Why? Because they're very ashamed to use it, because they have to carry the pad, and they don't want to use it in front of their friends, or sometimes they'll be in a co-ed school, or even in the girls' school, they are not comfortable changing it. Why? Because again, the lack of awareness. We should educate our boys as well. So whenever the girl, if you see a girl with a stained churidar or stained dress, you should not judge her. Just walk away. If you can help her, you can help. Otherwise, don't give awkward look about it. Okay, so it's just normal. Okay, so consider this is a normal phenomena of our life. Okay, so if you give a weird look of girl, definitely they'll be feel very awkward. So we have to educate our boys, our fathers especially. So try to talk with your daughter about menstruation. There's nothing wrong about it. Again, again, we are in India. Okay, so only mothers has to take care of daughters. So fathers will take care of their sons. Okay, so it's not about that. It's not a women thing. Okay, so if you want to bring a change in our community, definitely everybody has to talk about menstruation. If you see a girl with a stained dress, just no, don't react with that. Just if you want, you can help. Otherwise, just walk away. So, yeah.
Thank you so much, Tina. I love that. A lot of psychological tips that we can, use
Hopefully.
that'll help our women, right, feel more comfortable, more confident. So we're gonna go ahead and go to the next topic, you guys. And both Dr. Swarna and Tina a little bit fast so that we make sure we have enough time for a question Q&A. So let's go ahead and okay, so okay, I think we're going to move on to the directly to the Q&A portion to make sure that we have that time. So let me just get some questions that all our attendees have. Maybe we'll start with one or two, and then I'll see what we're gonna do from there. Okay? So one question that has come up that's probably relevant for most people is so this is actually a really great one. What are the things I should have in mind while selecting period products? So I know we've touched upon pads, but we have a variety of things such as tampons. We have menstrual cups now. We also have vaginal washes. So there's a lot of different products that are associated with our vagina itself. So what are some of those things that we should keep in mind when selecting these products? Either Dr. Swarna or Tina, either of you.
Okay. So it is entirely up to the girl. She can choose whatever she wants. There is no which one, the one is not superior or inferior. Anything she can choose based on her choice. But before that, she should know how to use that and how frequently it has to be changed. So these are the 2 points she has to consider. And in the cost also based on that she can choose the type of menstrual product she can make. So here, coming to the pads, the advantage in the pads is it is convenient. So she can easily use that when compared to the other most like tampons or menstrual pads. But the thing is, she has to change frequently, every 4 to 6 hours, and it is not that environment friendly. But here in tampons, the advantage of tampons when compared to the pads is she can go for swimming also, that is the advantage. And with the patch, you can go for that. And period of it again, like pads here also, she has to change her every 6 2 hours. And she needs initially some. She might face some difficulty when inserting the tampons, and the same difficulty she can feel for the menstrual cups also. So coming to the menstrual cups, it is advantage is she can keep for longer time and it is the way of collecting the blood. But here pads are absorbing, but here it is collecting. So then it is reusable. So that is the main advantage of menstrual cup. So it is reusable and you can reuse that. So that means obviously it is an environment friendly. And some means innerwears also are available. Reusable innerwears that also she can wear. So it is not just like which one is better and which one is not good. It is entirely up to the girl's choice, and she can go for any one of them.
Perfect. Thank you so much, Doctor. Tina, any like quick things you want?
I want to add one more thing because I'm seeing few girls are switching to cloth pads. Very recently, I'm seeing people are switching to cloth pads, but the thing is, it's not that friendly. So when you use cloth pads, you have to wash it properly. You should have the place to sun dry. If you're not able to do the sun dry part, then better go for disposable pads. That is really helpful and more hygienic. So don't think that we have again it's a myth saying that all the pads are contain some sort of chemicals that will cause cancer, cervical cancer, and other infections. So slowly people are moving into cloth napkins, so cloth pads. So you can so yeah, coming back to the cloth pads. So better go for disposable pads if you can. If you have the access to biodegradable pads, you can go for biodegradable pads comparing to all mats and dry mats. That is really better because it's a completely they are using it from cotton. Uh, yeah. So and tampon is also fine. That is also really helpful. You can use tampons, as ma'am said. You can use tampons and menstrual cup. You have to try menstrual cups. Actually, it's really user friendly. Maybe initially you may have a bit challenges, but for teenagers and young adolescents, definitely you have to use it with precaution. Why? Because chances of infection are higher if you're not using it properly. Definitely, it will be super comfortable. You may forget to change your, empty your cup. Why? Because you will not feel anything at all. Okay, so you have to make sure you empty the cup within 5 to 6 hours, and after usage, you have to sterilize your cup. That is very important. If you're super lazy, better go for pads and tampons, disposable one. So if we can properly use the menstrual cup, definitely can go for menstrual cups as well. Yeah.
Yeah, here I want to tell one thing that can be used for unmarried girls also.
Yeah.
Yeah, menstrual cup.
Perfect. Thank you. Okay, guys, we unfortunately had time for only one question. However, I will let you know if you have your pending questions. I will let you know where to ask and who to ask. So don't worry. We're gonna quickly see a video because Period Pal has put together this amazing session with all of us here today. This is just the start of our conversation. I know there's a lot more to discuss in terms of periods and a lot more important information out there. Dr. Swarna and Botina have given us such valuable insights with periods and especially with our first periods for our young girls. This is going to continue. Let's continue having these conversations. Period Pal's hosting a virtual marathon next month. So we're going to quickly see a video in terms of what this is going to be and what we can expect. So we finished our Q&A. And so maybe I think they're going to be sharing the video with you guys after the session is done. And so just in case you guys have more questions, I know we've had a lot of questions asked in our chat. Period Pal actually is an app, right? They have an incredible app. There's a tracking option as well as an ask the expert option. Okay, guys. And so any question that you have, so there's questions about post-COVID periods. There's questions about pregnancy. There's a lot of different questions that have come up, and we've stuck to early period, the conversation around early period. But any other questions that you have, please, use the ask our expert option in the Period Pal app, and you can get your questions answered. Okay, so let's go ahead and we'll conclude our session today. And we're so excited that you guys joined us. Thank you, Dr. Swarna. Thank you, Tina, for your time and your valuable expertise and advice for all our young girls, their parents, even for young men out there as well. All this information is important. Thank you guys so much. Thank you.
Thank you.
Thank you, Period.
I would like to congratulate and thank the Period Pal for organizing webinar on such an important topic called menstruation. Every girl should know about it. Thank you.
Absolutely. Thank you guys so much. And to everyone who attended, thank you for being here, to educate yourselves, your children. It's so important to have these discussions, and we will continue having them every day, every month, with our daughters, with our family. So thank you guys so much. Have a wonderful day. And again, Period Pal will be sharing the information for the event happening next month. So let's make sure we all join for that as well.